Hello and welcome to Rewired Mind Counseling Podcast. My name is Esther Obonde and I am the host of this show. Thank you for joining us for today's pioneering podcast on overcoming anxiety and depression using coping mechanisms. This will be achieved by integrating faith-based and clinical approaches and exploring ways that anxiety can be minimized, managed, or eliminated. I will be explaining my approaches in detail in my subsequent podcasts. Right, number 4. Do you have any suggestions for psychologists, psychotherapists, and other healthcare professionals to believe that their psychotherapy provision will be effective regardless of the attitudes and beliefs of the older adults? Do you understand, or should I read the question again?
I think
It's a very long question.
Yeah, go ahead. Go read it one more time.
Yeah. Okay. Do you have any suggestions for psychologists, that's the healthcare professionals, to believe that their psychotherapy provision will be effective regardless of the attitudes and beliefs of the older adults? Bear in mind that even a therapist has that in their mind that the older adult seeking help might not even value it because of those hindrances. But they are just doing it because they have to do it.
Right.
Without, having that belief that, they're helping,
Well, our medical and our psychological community is just can be so supportive of older adults. And I think that understanding that depressive mood is so the DSM, the diagnosing depression, it usually looks like at the last 2 weeks. But looking at a longer period of time for older adults, maybe over the last year, I have had a decrease in my interest and pleasure of doing activities. I used to walk with my friends in the community, but not looking just at 2 weeks time period, but a longer time period for older adults. That would be a key point to notice about depression is I've had a lack of interest and pleasure in activities I used to enjoy, not over the last 2 weeks, but longer. Maybe a year, maybe 2 years. Also, looking at, like I said earlier, is physical ailments, because a lot of times that they might be able to articulate. They might be able to articulate, I really have a lot of stomach issues lately. I have not been sleeping lately. And those things are easy to say, where saying, because it's hard to formulate and put into words. I've never been able to talk about my emotions growing up. You had to work on the farm. You had to work in the factory. You had to work and take care of the kids. Yeah. So now you want me to talk about emotions? I'm not even sure how to put that into words. Yeah. But I can put into words that my stomach hurts or I got a headache. When helping them to be able to talk about memories. To me, talking about things that are starting to have points that are easy to talk about. It's easy for me to talk about when I used to go with my dad to the corner grocery store and talk about things and then using that as a jumping point off to other things. What did that feel like? Yeah. So that you can help the older adults to start to put words to emotions. I think a a lot of times counseling of older adults is helping them to be able to put words to feelings. Um,
Because of the connection between, thoughts and feelings.
Right,
Words
right.
and feelings.
right. So again, the key to interviewing is to ask changes over a more extended period of time. It's not uncommon for a person, a client, to just self-criticize. I'm just lazy. That's why I don't go out with my friends anymore. I'm just, something, and just to self-criticize. Also to understand that depression a lot of time comes out as anger, and especially in men, that frustration. Again, it's that articulating emotions. So I'm angry. Well, when you can get past, I always say that working with older adults takes a thick skin. Kind of like children. They just tell you like it is. I don't like your clothes. I don't like your hair. They just tell it like it is. Sometimes older adults can be that frank, and you need to have tougher skin. But they can be maybe abrasive when they are depressed, because that is the way that they can't articulate the words. So helping them to put words to emotions, I think, is a critical aspect of counseling older adults. Also, if we can early identify depression, we can also help older adults keep their activities of daily living. So if I am low, depressed, unhappy, anxious, I might sit on the couch more. I might just not get out of my wheelchair. I might not do a lot of things. And then suddenly I lose some muscle strength in my thighs. And then I can't go to the bathroom, or I can't get myself up. So depression has a real snowball effect. In that if we can identify depression earlier, we can hopefully help that older adult with keeping their activities of daily living, and where they can live independently or still be actively engaged. And like you said early, that social isolation is just really a critical issue. Yeah,
It's a huge thing.
yeah. It decreases immune function, cognitive decline. It's just really getting people engaged with other people is just crucial. And as you know, with depression, we most of the time isolate. We pull back from others. And older adults are especially pull back into withdrawing. And because a lot of times it's hard to explain what emotions, which ones are which. Do they matter? Am I making a big deal out of nothing? Yeah.
Yeah, well said.
Yeah.
Well stated.
Yeah.
Do you have any word for the younger generation that has older people around them? Is there any word you can offer them to, adjust or mend things?
To amend fences, or
To help their older, relatives.
Sure.
To, enhance their mood and, help them.
Well, a lot of my work has been life story work, and it's to build connections between people, between the generations, between nursing home staff and older adults. And so if I know your stories, Esther, I know your upbringing, I can suddenly have some more compassion and understanding for maybe your mannerisms, maybe, like a minute ago I said to John, I use my hands. You might think, I was Italian, and once we understood a little bit of someone's background, we might be able to say, okay, I understand. So listening to people's stories builds connections. It can build compassion and empathy. I can see that this person that's lying in bed, that is bedridden in a nursing home, she was a World War II nurse. She did, battles. She went into the battlefield. She nursed people on the battlefield. When I understand that, I don't just see her as a patient anymore. I see her as a person. And I think it builds a connection, an empathy for that person. So I think with the younger generation or with any of us, if we can hear stories and ask, what's a favorite story from when you were growing up? What is one of your favorite memories as favorite birthday? I didn't have any good birthdays. Oh, do you have a favorite pet? Something that's non-threatening, and asking about some of those early memories will start to open conversation with the older adult, and it's non-threatening, and it starts to build relationship, and for the listener, it can help build compassion and empathy.
Yes, that's true.
Yeah.
That's it's interesting. It's a very it's a problem in the society about how the older population are managing themselves. Even in those in the nursing home, as you said, don't even get help.
Right.
They don't have anyone visiting.
Right. Yes.
It's a serious problem.
Yes, it is. Yes, it is. Yeah.
They
Right.
go in there. I've once worked in that facility, and I know how they feel.
Yes.
you
Yeah.
know. Nobody visiting them at all. Nobody relating with them.
Right.
But thank God they've gotten the staff and all that to keep them going.
Yeah.
you
Yeah.
know. But they need more than just
Right.
the staff.
Right.
And
Right.
all the resources they
Right.
need, so that pets and all.
Right. And the staff is overworked and
Overworked, yes.
underpaid.
Underpaid.
Yeah. So it's a tough situation.
It is,
Yeah.
It is.
Yes.
It is. And I like the work you do can you say a little bit about what you do so that we can tie it in with, say a little bit about what you do.
Yeah. So I have an organization called Life Story Work, and it is a nonprofit organization, and it's dedicated to improving the care and dignity and quality of life for older adults. And it's by listening and capturing and preserving each person's history. So we want to listen and teach people to listen and listen well. And we hope to instill in others a respect for another person's experiences, and a recognition that every person has value. Storytelling can heal the storyteller, and it can heal and impact other people.
Just like talk therapy.
Yes, yeah, yes,
Yeah,
exactly.
that's good.
Yeah. So we try and build also storybooks or some sort of product. And right now we're just doing books. And so Life Story Work pulls together, let's say, a book. So I would listen to your stories and then compile those stories and add pictures if you had pictures.
Okay.
If not, I would Google some pictures. One woman, she was a cheerleader in the 40s at a high school in Houston, and I Googled photos, and actually somebody had scanned photos of her yearbook, and there was a picture of her cheerleading in the 40s. And I was able to put that in her life story book with her stories and compile it into a book and give that to that person. They can share that with others if they get transferred to another facility, or if they did become demented, or they went to a hospital. Somebody else had their stories, could read them to them, could know a little bit more about that person. Yeah. And again, so that there would be compassion and empathy for that person as an individual and not just a patient. So we want to support people in listening, train people to listen, train people how to work with older adults and listen well. And
that's good.
Yeah.
That's good. Is it just for the older population? Can that life story be done for somebody, say, between 40 and 50?
Oh, absolutely.
Is it? Yeah.
Absolutely.
Okay.
So I've had some younger people in their 40s or 50s,
Oh.
but Life Story Work started out as an intervention for children that were adopted, so that any stories, any information they had about the child
Oh,
could go with that
right.
child to their adoptive family.
That is
Yes.
great.
So it was, that's how it started, but it's found that it worked very well for people with dementia, any form of dementia, and now used for older adults in other settings in the community and nursing homes, whatever facility. But it's capturing their stories. And what I like is the older adult gets to say their story in their own words, not in my husband's words, not in my daughter's words, but in my words. This is how I remember 1, 2, 3, and it's special to them. And
That's very good.
yeah,
That's very good.
yeah.
I love what you do.
Thank you, Esther.
Yeah.
Thanks.
And thank you so much for coming on this podcast. And we'll be doing more because there is a lot you
Yeah,
have
there is a
to
lot. Yeah.
share with people.
Yes,
You know,
yeah.
especially those who are hurting,
Yes.
isolated, not knowing
Yes.
what to do.
Yeah.
So we need to get the word out there.
Yeah.
So
And
thank you.
listening is
Yeah.
a lost art.
Listen, yeah,
You know, so-
because the world is it's a busy,
Busy.
place now,
Yes. Yeah.
and nobody has time to listen.
Right. Right. Yes.
Yeah.
Well, it's a privilege being here
Oh,
today,
I'm
Esther.
so blessed. Thank you so much.
Thank you.
Thank
Yeah.
you. Right. We will continue to look at the issues surrounding anxiety and depression during the upcoming podcast sessions, which, will plug you in at some point again, come up with something. All right.
All right.
Yeah. So these depression and anxiety, is an interesting as well. It's interesting to look into it.
Yeah.
It's not a normal
Right. That's
phenomenon,
right.
as you said.
That's right.
So it is broad, it's inexhaustible,
Yeah.
and with vast tools and techniques and strategies, we can, acquire wellness over a period of time. So, as you said, medication, you mentioned that medication isn't always the answer.
Right.
So, at this point, I would say lifestyle,
Yes.
getting those tools and techniques and using them frequently and
Yes.
consistently
Correct.
to the extent that it becomes a lifestyle
Correct.
will then help,
Right.
counteract the effects of, or even having anxiety and depression. So I believe in lifestyle.
Yes. Yes. Very
Yes,
much.
medication is very helpful.
Sure.
It's good when needed.
That's right.
Especially those who cannot, help
Correct.
themselves. Yeah.
Right. Right.
Right. So we are excited that we are bringing, as time goes on, we'll be bringing guests, on a larger scale, like go via Zoom and then share. That will be, I'm looking forward to such a time, and I'm scouting around to see, guests to come in and also bring in their various experiences and expertise. So, and this will be an ongoing thing, even bringing in guests and larger audiences coming in. So it's an ongoing thing. So feel free to come in, and whenever you feel like, or whenever there is the need, to come and share with the world what you have to give. So, and the podcast thing will be weekly. It's a weekly thing. It will be done weekly, and beginning from Mondays, we'll be publishing. So at this point, we'll be having more than one episode in a week. So I will ask my audience to stay tuned and listen to this podcast as we dish them out. All right, and that's it. So if anyone is happy with the topic we've discussed, please follow the websites. So I will include your website so that they can go to your website and connect with you. And thank you so much for listening. We hope to see you on the next episode. Thank you. And have a blessed day.
Thank you.